Namaskaram. My name is S. Ashok Kumar. Welcome to my channel. In the last part, I started explaining about the thyroid gland. In that part, I explained about what are the thyroid hormones and their biological effects. And in this part, I am going to continue the thyroid gland with its disorders. The first one, I am going to tell about the cretinism. Cretinism. What is actually cretinism means? So within these thyroid hormones, disorders of thyroid hormones, first I am going to tell about the hypothyroidism. Hypothyroidism. What is the meaning of hypothyroidism? Lower, or there is a deficiency in the synthesis of thyroid hormone. Deficiency in thyroid hormones is a hypothyroidism. Within that, first one is a cretinism. In this cretinism, there is a deficiency. There is a deficiency in thyroid hormones. Deficiency in thyroid hormones during pregnancy. During pregnancy. So, when the person is pregnant, when these thyroid hormones become deficient, the effects are more on the infants. The effects like there is a slow body growth. There is a slow body growth. Next, mental retardation, etc. in infant. Okay, so that condition, deficiency of thyroid hormones during the pregnancy, those effects we'll see on the infant. Such condition is a cretinism. Same, the deficiency of thyroid hormones, if you see in the adult, that is a myxoedema. Myxoedema, or you can call it as a Gulls disease. So I said same thing. This myxoedema also, there is a deficiency in thyroid hormones in adult. So the symptoms are similar, like same thing only. Those include a lack of alertness, that you can call it as a dullness. The person is not much responsive. So next one is a low IQ value. Low IQ. That means you can take like mental retardation, etc. That's already I said. Thyroid hormones become a deficiency. So many symptoms person can show. So the next one is like, that is a simple goitre. This is a commonly we can see this one. What is the simple goitre means? Enlargement of thyroid gland due to deficiency in blood iodine. First understand this one, I will explain. Simple goitre means that involves enlargement of the thyroid gland due to the deficiency of the circulating iodine. Here, for example, to understand this one, just consider in thyroid gland, for example, that is with reference of the follicular cells, outer follicular cells, normally two cells are there. Okay, for your understanding. Under normal condition, that means when the blood iodine level is sufficient, these two cells are synthesizing the enough thyroid hormones and moving. For example, consider that blood iodine level is somewhat reduced than the normal. Still, body need the same amount of thyroid hormones na. When some amount of that circulating iodine somewhat reduced than the normal, these follicular cells undergo division. These cells become 4 cells. Then when these cells become 4 cells, these 4 cells somehow they absorb the iodine from the blood and synthesizes the normal amount of thyroid hormone. For example, still the blood circulating iodine, that is still reduced. Again these cells become 8 cells. Then these 8 cells each one absorb the small quantity of iodine from the blood and synthesizes the normal amount of thyroid hormone. That means with this one, that means if you are in this condition, you need to understand why this thyroid gland is enlarging, or why these follicular cells undergo division. Means you can understand in order to increases the efficiency of thyroid gland. Otherwise, in order to maintain or in order to synthesis of normal amount of thyroid hormones. That is why that simple word enlargement of thyroid gland, that is actually positive thing. It's not negative thing. It's a positive thing. That is in order to maintain the or in order to synthesize the normal amount of the thyroid hormone. How to recover from this simple goitre? Simply, you can supply the normal amount of the iodine through the food. Automatically, these cells gradually they become a normal. It become a normal. That is why simple goitre is recovering is very simple. That is why I said for synthesis of thyroid hormones there is a absolute need of iodine. Okay, na? These cretinism, myxoedema and simple goitre related to the hypothyroidism. The next one is like hyperthyroidism. Hyperthyroidism or thyrotoxicosis. What is the meaning of this hyperthyroidism? Excess production of thyroid hormones. That leads to there is a toxic effect to the body, that is a thyrotoxicosis or exopthalmic goitre. Exopthalmic goitre. Last one we saw is the simple goitre. Now this is exopthalmic goitre. That means in this goitre there is a bulging of the eyes. That is why that is a exopthalmic goitre. Example for this one, hypothyroidism, that is a Graves' disease. Graves' disease. I will explain you, just wait. The first point is this. In this Graves' disease actually autoimmune disease. Autoimmune disease. That involves, the Graves' disease involves formation of LLTS. Simple. What is the meaning of LLTS? Long lasting thyroid stimulators. One more time I am telling. Graves' disease involves the formation of LLTS. Long lasting thyroid stimulators. You will get it out. Actually, what is this LLTS means? Very simple. These are nothing but a type of antibody that is nothing but IgG. Okay, so Graves' disease involves the formation of LLTS. So what is the logic here? For example, you take the follicular cell, because follicular cells only responsible for the formation of thyroid hormones. Consider this one. This is a follicular cell. As we know, consider this is a specific receptor for thyroid hormone. So normally what is happening when TSH is present, TSH how it formed we know na? From the hypothalamus up to the TSH. So on the normal condition, TSH, thyroid stimulating hormone, come and binds with the receptor on the follicular cell, activating the follicular cell to produce as the normal thyroid hormones. This is the thing. Here in Graves' disease, very simple logic. This LLTS, so-called antibody, is a molecular analog. Molecular analog to TSH. Bus, you can understand. So LLTS is a molecular analog. Analog means what is similar to whom? TSH. So when I said itself, you can understand. For example, when there is no TSH, so automatically these LLTS go and binds with these particular receptors. How they can bind? Because they are specific receptors na, only for TSH na. But here the logic is the structure of the TSH and the structure of LLTS both are similar. That is why in its absent TSH absence, LLTS go and binds with the receptors on the follicular cells. Automatically what happened? The name directly indicates a long lasting, and they continuously stimulates the thyroid, that is the follicular cells of thyroid gland. Long duration. Automatically what happened? There is excess production of thyroid hormone. That excess production of thyroid hormones we are calling as a hyperthyroidism. Excess production of thyroid hormones. What are the symptoms you can see? With reference of this one means you can see like weakness, muscle weakness you can see. The next one is a weight loss, excess sweating. There are so many, etc. There are so many symptoms you can see. That bulging of the eyes, that is why exopthalmic goitre, that means the bulging of the eyes. That eyes is like a coming out. That is one of the very known symptom with respect to of hyperthyroidism. That is a Graves' disease. So these are the different disorders of the thyroid hormones. So till now, if you understand this concept well, you can like and share this video to your friends and subscribe our channel. Definitely this topic, chemical coordination and integration, from this chapter, definitely you will get 3 or 4 questions to the NEET exam. Absolutely, those 4 questions or 3 questions, 100% I will cover in my topic. If you have any doubts about this chapter, you can comment below. Definitely I will respond to your questions. Thank you.